Welcome back to Living East Tennessee. Well, this business is helping those with spine and nerve issues through the treatment that they offer. Joining me today to share more is Dr. Douglas Sanford and Tiffany from Maryville Spine and Laser. Welcome to the show, you all.
Thanks for having us, Amber.
Absolutely.
We're really happy to be here.
Well, I love what you all do, and the personal approach that you take to your care is so important. So today we're here to talk about peripheral neuropathy.
Yes, ma'am.
Tell me what that is.
So peripheral neuropathy is a chronic, progressive, almost debilitating condition. It's a problem with the outside of the nervous system, so the brain and spinal cord or the central nervous system. The peripheral nervous system is anything outside. It typically starts in the feet and goes to the hands, and what happens long term is you can have a lot of balance and coordination issues. So it typically won't be pain, it'll be discomfort, burning, numbness that generally starts in the feet, goes to the hands, and then long term you start to lose the ability to sort of know where the ankles are in space, and balance and coordination issues develop. That's our main concern. So some people could be affected with the numbness, burning, tingling, can't sleep at night, and then some people just lose the balance and coordination. So we see all kinds of different cases.
Yeah, that is so interesting. And I know you see these firsthand as well. What has been some of your experiences with treating patients like this and treatment options?
It has been the most rewarding thing I've ever done in my life. For instance, one of the first patients that I treated went from coming in a wheelchair to barely using a walking stick when he was done. So another person had not felt the grass in over 25 years. So it's a lot of happy tears.
Yeah, absolutely.
Yes.
I can imagine that's absolutely life-changing. And to have somebody local who truly cares about diagnosing this condition, working through that, take me through this chart right here and kind of what that means when we're looking at this condition.
Sure. So when you look at a typical nerve, this is healthy, and what you're seeing is the arteries are nice and healthy inside the nerve. So it's the microvessels, if you imagine the tiny nerves in the feet that communicate with the brain, that tell it where the feet are, and it tell it if you stepped on something hot or if there's something, you know, in your way, you kick a door with your toe. So we want that arterial supply in the nerve to be healthy, and what will happen is usually diabetes is the most common cause of peripheral neuropathy. That's probably about 40%, but another 30 or 40% is what they call idiopathic, or we just don't know why the person has it. Now there's many different disease processes that will cause it. Upwards of 100 causes of peripheral neuropathy, but diabetes and idiopathic is the most common. So what happens is the arterial supply starts to die off and the nerve can't get the oxygen it needs. So this is where you've lost about a third. You can see the nerve starting to die off and it's just not getting that oxygen. This is about 60% gone, and this is almost gone too far to treat. So once it gets to this phase, then we've seen patients that have had, had to have amputations and things like that. It can become a horrible disease process. It doesn't get that bad with everybody, but it's definitely possible. So what we try to do is when you come in, we'll do a neurological evaluation to determine where you're at on this scale. So the test comes back 0 to 100. So 0 is very healthy and 100 is very bad. So when you get into the 80s and 90s, it just shows us that that nerve has died off, and we're probably not going to be able to bring it back. But if you're lower than that, we'll go ahead and treat with 2 types of laser the first day you're there. We're looking for you to go home and have some immediate relief of discomfort. It either works or it doesn't. There's no two ways between. And so you'll come back in within 48 hours and we'll retreat and retest and make sure your score gets better. So say you have a 70% sensation loss and you come back in and now you're at a 60 and you've had relief of discomfort, we're most likely going to be able to address the issue, and we say fix your feet. When we say fix, we look for a 70 to 80% resolve of the patient's symptomatology, but the results are permanent, they're lifelong. Then you can start to work on the balance and coordination, so it really can change your life from going through the process to where you're not able to walk, or you can't sleep at night with that burning, that discomfort and things like that. Or taking medication that just mask it. One of the problems with neuropathy is there is really no FDA-approved medication for neuropathy. So it's either, most doctors will tell you, well, there is no solution or there is no treatment, when there really is, but this is only about 10 years old that we've came up with this laser-based therapy system.
That's incredible, and you've seen it firsthand, telling these incredible stories that you shared earlier, people being able to feel the grass again and get back their lives, get back to, playing with their grandkids, different things along those lines. Where's that website people can find you guys and get in touch with you immediately so they can get back to living life? Absolutely.
Sure, and so we're at MaryvilleSpineandLaser.com. Definitely check out what some people are saying about us. Look at our reviews. Give us a call if you want to come in with this TV airing. We'd like to offer people can come in, and we'll do those first 2 visits and find out whether we can help you or not. We're not going to charge you for that. We're just going to say, okay, is this somebody that's a candidate for care? Do they respond to the laser-based therapy? So give us a call, reach out. We're happy to get you a day and time to come see us. If we can help you, we'll let you know. But if not, I promise I will not waste their time or mine trying to treat something we can't make improvement with.
Well, thank you guys so much for hanging out with us today. You all are incredible. Thank you for what you do for so many people and caring. So we'll love to have you back sometime. Absolutely. Thank you guys so much.
Thank you.
Thank you.
Alrighty.